The views and opinions expressed by the hosts of Black Talk Radio News and any guest represents their views and their views only and do not necessarily represent the views of the Black Talk Media Project or the Black Talk Radio Network. Hello and welcome to BTR News with Scotty Reed, and joining me for this episode about systemic racism in medical care for non-white people in the United States is Dr. Hetty Cunningham, who will talk about these issues, which will be featured in the Oprah Winfrey-produced film, The Color of Care, which premieres this Sunday, May 1st at 8 p.m. Eastern on the Smithsonian Channel. Black Talk Radio subscribers can also visit www.smithsonianchannel.com for more information. Thank you for speaking with me today, Dr. Cunningham.
It's my pleasure. Thank you so much, Mr. Reed.
Before we get into this complex issue of subpar healthcare for non-white people in the United States, can you tell us a bit about who you are as a person? And for instance, at what age did you know you wanted to be a healer, and what age did you start to map your path to where you are today in the medical field? What were your inspirations?
Well, I feel like probably prenatal, because my parents met demonstrating for CORE back in the 60s. So it's been a long path. And then my mother is a Harlem resident and an educator, and my father is a pediatrician and an activist. So I guess you could say I came out that way. You know, I've been so fortunate to be able to come to Columbia University and follow some leaders who were doing deeply embedded community work and anti-racist work, you know, way back 23 years ago. So it's been kind of a natural path, but I've been so fortunate to have amazing mentors along the way that I could learn from.
Well, that was going to be my next question is, did you have any role models or mentors that you can go ahead and give them a shout out who helped you get where you are today?
Oh my gosh, there's just so many. I mean, Dr. Dodie Meyer at Columbia is someone who I came here to work with. There's so many. Sidney Hankerson is someone who's doing a lot of work in the Black churches here. Bob Fullylove, also another partner in that. So people who are doing deeply impactful work in the community to change health disparities. Dr. Olajide Williams is someone who's very, very active here at New York Presbyterian, and people who I've been working with and continue to work with. Also, Al Cohal is another person who I work tremendously with. And then my one of my kind of partners in crime currently is Dr. Jean Marie Bradford. So there's just so many people. And then on the national stage, Aletha Maybank is someone who's, you know, most recently kind of the inaugural director of equity and justice at the American Medical Association, which is traditionally a fairly conservative organization, but she's been transforming on the national stage. There's just so many people.
Now, you mentioned your parents being activists, and I assume this was during the 60s, 70s era.
Mm-hmm, mm-hmm.
Now, speaking of trying to address racism and you know, disproportionate bad health outcomes for people of color and specifically Black people, did they ever mention to you once you made it, you know, clear that you wanted to take the path that you took into the medical field of the early work of the Black Panther Party, which I don't think, you know, their contributions to addressing the needs of Black people in healthcare gets enough discussion, but were you aware of that? Did anybody ever bring that to your attention?
Oh, yes. Oh, yes. The Black Panther movement was very instrumental here in New York City in bringing healthcare and this concept of, community health workers. You know, they were at the forefront of that. And then when I trained down in Philadelphia, the MOVE organization similarly, was continuing that even when I was down there in the early 1990s. So there's so many grassroots organizations that have been at the forefront of this struggle. And yes, I was aware of that. Mm-hmm.
The upcoming documentary, The Color of Care, which again will be on the Smithsonian Channel on May 1st, that's this coming Sunday at 8 o'clock p.m. Eastern. How did you come to become a participant in the documentary? Was there anything about your previous work that made you a quality candidate to participate in disseminating information about the subject matter? And I've already established, before we started, that you are already involved in professionally in this work as a co-leader for the Anti-Racist Transformation in Medical Education project. So you think that's one of the reasons that you came to participate?
Yes, absolutely. And when Mr. Ford reached out to me, it was kind of at the height of when there was so many, we were finding out about so many health disparities, and family members who I have in Brooklyn were reaching out to me and telling me of just horrible stories, very similar to the ones in the film. And in addition, I've been teaching and educating about health disparities for over 20 years. So when Mr. Ford reached out to me, it was the perfect kind of overlap of professional and personal passions. So I was grateful to be involved in the film. In terms of the Anti-Racist Transformation in Medical Education program, this is a program that was started at Mount Sinai. And the objective is to, we're a cohort of 11 medical schools across the country that have been brought together by leaders at Mount Sinai. And the idea is that we all need to learn about organizational change and how you make organizational change happen. So we're all in our medical, schools, participating in all kinds of initiatives, all kinds of anti-racist initiatives. But at some point, we're kind of putting our finger into holes, we're kind of plugging dams. And so they're really encouraging us to step back and look at the system and who are the people that we need to engage in this effort. Predict where is the resistance going to come from, and how are we going to manage that resistance when we get to it? What are all the stakeholders that we can bring into our effort, and how can we speak to them? What's the language they're speaking? So on all different levels, how can we create a movement that won't be a flash in the pan, that will endure? So it's very interesting, actually. We've been participating in this cohort of 11 medical schools, and we're kind of chomping at the bit, because they're saying, hold off in doing, think about how you're going to do and how it's going to sustain. And, so it's really, we're learning, and they're educating us to have the maximal impact in the maximal area that will sustain for the longest time. So not just recruiting those people in the choir, but how we bringing more people into the church, to use that metaphor. So that's what that initiative is all about, and it's very exciting and on time as well.
And so I have two questions from two Black women who follow the podcast. I asked my audience if anybody would like to ask any questions, and that might be covered in The Color of Care, which again is airing this Sunday at 8 o'clock p.m. Eastern on the Smithsonian Channel. Now, their questions are, how, and these are general questions speaking to the issue of systemic racism in the healthcare system. So these Black women ask, how are they going to improve not having fatalities amongst Black women during childbirth and after giving birth? I don't know if this might be something talked about in The Color of Care, but if so, great. If not, what are your thoughts on it, Dr. Cunningham?
It is covered, it is talked about in the film, and there are a lot of initiatives in this area. This is not my area of expertise, being a pediatrician, but we were actually we had the opportunity to go and speak with members of Congress actually 2 days ago with Mr. Ford, the director, and some other participants in the film. And we talked about the disparities, the maternal and infant mortality disparities in Black women. And they are introducing legislation. This is an area that I think everybody is much more aware of. And this film is an attempt to keep the discussion going and to really keep the urgency around this issue at the forefront of people's minds. So we are engaged in a number of initiatives in the medical schools. Some of the most significant, and I would say the medical schools, but also the scientific community overall, some of the most significant are making sure that people are learning about how to care for people with dark skin. You know, American medicine came up in the time of segregation, and there are many things that you would be surprised, right? Like most of the education is the pictures that you see are on people with light skin. And so historically, doctors have not been trained to recognize, let's say, anemia, which is low blood count, low oxygenation. You know, you talk about cyanosis, which is how you see low oxygen physically on a person. Our medical institutions are not doing as good a job as we need to be able to recognize these things on people with dark skin. This is something that the Black Lives Matter movement and this time that we're in has made, and these disparities has made much more visible, and has heightened the medical community's awareness of these issues. So from those kind of even very simple tasks, I was just reading about a Black woman who's a physics graduate student at Brown University who's working on a pulse oximeter, a technology that will pick up low oxygen levels on dark skin as well as on light skin. This is a technology that has not existed to date, which is shocking. But these are some of the initiatives, and then there's just so many more. I think all over the country and maybe even all over the world that this movement that we're in now has brought these deficiencies to light.
And would you say these deficiencies are of a global nature, not just here in the United States?
I do think they're of a global nature. I think that European countries, because they have more money, drive initiatives in medicine globally. But if you go to a majority, like if you go to Africa or, where people have darker skin, they know how to treat, right? So they know how to recognize these physical symptoms. So we have to also learn from our colleagues in areas where, where people have, like darker skin and they know what to do, but we typically think we're teaching them. People here in America and Europe think, oh, we're going to go over there and teach them. There's a lot they can teach us, and we need to listen and learn.
Well, that actually is a perfect segue into the second question. And she asked, why don't they listen to us as Black people about our health concerns?
I think that's an excellent question. And it's a huge problem. We know that Black people are not listened to. And this is, research studies show that, our experience tells us that, but a lot of times, we may think, that perspective may not be respected. How are we teaching medical students and our faculty and our clinicians at my institution? That has to do with educating people about the history. When you see in this film, you start to understand where these biases, we call them implicit biases, where do they come from? They come from the whole history of the way our nation is set up, residential segregation, redlining, so that when somebody comes to the doctor, maybe they were late, maybe they missed an appointment, they're blamed for the issue, rather than understanding that they had to take 3 buses to get there, that the how long they had to wait for an appointment, or just
Couldn't find a babysitter.
Couldn't find the babies, all the millions of reasons. And so one way to combat this lack of empathy, this lack of listening to the patient, understanding where they're coming from, is by presenting the history. So it's not enough now to say, oh, this person isn't taking their medication. We're teaching students to say, why is that? What are the reasons behind that? And to understand even all the way back historically, and that adds empathy. If you don't understand the history of all the ways in which medical care is made so very difficult for our people to access, then when someone comes, you think, oh, is their fault? And that was something that I think we saw so quickly in the COVID era, that these health disparities were so quickly blamed on the very people who are suffering. Oh, well, it's because they don't eat right, or something like that. And so that needs to end. And there are initiatives to change that. But we need to keep this momentum moving forward and keep up the pressure.
Well, these questions and some of the answers you have given us is perfect segue to what I wanted to ask you about a viral story sparked by the video diary of Dr. Susan Moore, a Black physician who contracted COVID-19 and complained of the inadequate care she received before dying. The New York Times wrote, Black doctor dies of COVID-19 after complaining of racist treatment. He made me feel like a drug addict, Dr. Susan Moore said, accusing a white doctor of downplaying her complaints of pain and suggesting she should be discharged. Did you hear about Dr. Moore's story and your thoughts on that?
I did hear about Dr. Moore's story. And it was devastating, but not surprising. This happens every day. And Black people, Black women are not respected. We heard from Serena as well. She was able to shine. This is a doctor and a national hero, that they were able to shine a spotlight on this area. But this is not news. This has been known. The film highlights the 2003, 20 years ago, report from Congress, the Institute of Medicine, reporting on unequal treatment. And this same data of Black people not being treated for pain. These studies are well known. Well, they're well known to people who are listening. In my specialty, the studies of Black people not being treated as aggressively for pain, the most severe disparities are actually in Black children, which I think most people would be surprised to know. So we have a lot of work to do.
Now, on the coronavirus pandemic, which is something that touched my family personally, I was the only one who was vaccinated at the time because of my status and access to the vaccines through the VA healthcare system. I am a veteran. And so I had access before a lot of people were able to get access. But my entire immediate family, meaning my mother, my children, 2 daughters, and then both my grandchildren with those 2 daughters. So, and our mother really just suffered a terrible bout of it, was placed on oxygen. Thankfully, she was never hospitalized, and she recovered and is doing well thus far. But the disinformation that I was seeing targeting Black people on social media anti-vaccine disinformation. And I tried to combat that through some of the media that I was producing, but I want to speak to you, and perhaps again, the color of healthcare might cover this, but can you speak in general terms to what the data shows on the mortality rates of the different groups and likely causes as it relates to the pandemic?
So the film does talk a lot about the mortality rates, and I'm not going to try to guess the exact numbers, but Black people in this country, our mortality rates are much, much higher than any other group. In terms of the disinformation, I think this is a worldwide problem. I just heard on the radio today that disinformation is one of the a big topic of conversation, for nations meeting, I think this week or next week internationally. And a lot of those, anti-vaccine websites were set up in Russia. I think it's a huge problem, not only with vaccines, but politically, it's a huge threat to our health and our democracy. I'm glad your family is doing okay. In terms of vaccines, I mean, it was really hard. My family also had a real hard time coming around to trusting vaccines. It seemed like if one person, within a community got vaccinated, then, other people would look at that and say, oh, they did okay. Now I'm going to get
that was exactly the case with my family finally getting vaccinated. Was I had it, and and they saw I didn't catch it, thankfully, and even though I was all around them and in close contact, but I was vaccinated. But yeah, disinformation is big. I didn't mean to interrupt you, but I know we're kind of pressed for time. But lastly, I would like you to tell us how this documentary is a important watch for non-white and white people in a white people dominated healthcare system. Give us your personal pitch for why it's worth our time to tune in this Sunday at 8 p.m. Eastern on the Smithsonian Channel.
I think there's a number of reasons. One is, for me personally, the movie itself is like a memorial to the people who passed. So many of our people passed, and they're just oftentimes thought of as numbers. And this movie puts a face to our suffering. And to me, that's one of the most powerful. It's a truth-telling opportunity. In addition, I think people will start to connect the dots and understand how we got here, and understand some of the really important facts and figures that are behind this story. So Mr. Ford is a master storyteller, and he does a really amazing job in bringing both the humanity, the science, and the statistics together. And I'm hoping that, in our medical school, this will be watched. And in medical, they're planning, a whole year-long campaign to bring this movie to the very people who need to see it the most, probably, which are the medical community, because it's very educational. But then, in terms of just people in general, people who've suffered, I think it's a moment of honoring, especially the frontline workers who put their lives at risk for the rest of the community and our nation, and that comes across very clearly in this film. They did not have to do it, and they did.
Right. Well, thank you for joining me. And do you have any final thoughts that you would like to express?
I'm just so grateful for the opportunity to speak with you today, Mr. Reed, and for the opportunity to be involved in this film, for Mr. Ford for making it, and for Ms. Winfrey for promoting it, and for seizing this moment to not lose the opportunity to move this critical issue forward. We have to keep we have to keep talking. We have to keep advocating.
Thank you. And you have a great rest of your day, Dr. Cunningham.
Thank you so much, Mr. Reed. My pleasure.
And again, I just want to remind the audience that the film, The Color of Care, the documentary, will premiere this Sunday, May 1st at 8 p.m. Eastern on the Smithsonian Channel. Thank you for joining me here on Black Talk Radio News, part of blacktalkradionetwork.com.